As a physician, no one has the right to take my intellectual skill, my intellectual and skill property, but if they do, all I've become, this reads like almost all doctors' handwriting I've ever seen on a prescription, I've become is a government agent with an MD degree. Free markets will prevent this. Comment.
I agree. I don't know what else to say about that. I think it's absolutely right. It's kind of like somebody came up with the eminent domain parallel, and I think currently government feels that they have eminent domain over your skills, and that is a very, very scary place to be.
100 medical school students recently lobbied in Harrisburg for a single-payer system. Why are most active medical students so supportive of a single-payer system as opposed to market-oriented, very similar to the question about why 59% of doctors?
Right. Because their professors are, and that's all they hear. I mentioned Regina Hertzlinger earlier. She told me that she that she gave a talk to the Harvard Medical School. She's at the Harvard Business School. She gave a talk to the Harvard Medical School and laid out some of her ideas. And all of the students there said that is the first time they had ever heard any presentation that was not single payer. That's all they're getting in school. Single payer, single payer, single payer, single payer. Because frankly, the professors at medical schools are lousy doctors. They avoid clinical care because I don't think they know how to do it, and they retreat into academia because they're not up to actually caring for patients. And the docs that are out there in the world actually taking care of patients think all that is garbage. And so bravo to all the clinicians out there.
It's a shocking observation. In every other area of life, the most skilled go into academics. Let's make this the final question of the evening. Why do we continue to move towards government-run insurance programs?
I don't know. People like easy answers. It seems like an easy answer. But I don't think we really are. I think if you look at the track record, people talk a lot about evidence-based medicine. Well, let's have some evidence-based public policy for a change. If you look at the track record, all of the evidence says that these government programs fail in every regard. Medicare is a very popular program. As I mentioned, Medicare only pays 50% of the elderly's health care expenses. The elderly, on average, and this is from the Commonwealth Fund, which is a very, very liberal organization, the elderly, on average, pay 21% of their income for out-of-pocket health care costs. The same Commonwealth Fund argues that anything more than 5% of your income on out-of-pocket expenses means you are underinsured. So everyone on Medicare is underinsured by their definition. And yet, even with that, Medicare is $37 in the hole. There are $37 trillion in unfunded liabilities that our grandchildren will have to pick up someday. It is an outrage. It's a shame on America. People should be angry about it. We should not be celebrating how wonderful Medicare is. We should be deploring it because it's a failed program. And if you match up any kind of consumer-based effort to any government program in America and compare them on an evidence-based public policy standard, the empowering consumers is the way to go.
Thank you, Greg Scandlen.
Thank you.
Okay, this wraps it up for this evening. The ball's now in your court. Go out and vote.